is Nadia Fawcett. I'm the Vice President of Engineering with Greystone and also your board chair for the Chamber. I'd first like to invite Keandre Dunham from the Brookman Group to come forward and lead us in our invocation and pledge.
Good morning. Let us pray. Heavenly Father, we come before you today, first giving thanks for all your many blessings. Thank you for the opportunity we have to gather in this space. We're blessed to live in an amazing community with so many great individuals with service on their minds and in their hearts. Today, as we learn about the state of healthcare in our community, we ask that you continue to give us good health, that you continue to provide our medical professionals with all they need to be of service to this community. We ask that you continue to remind us of your second commandment of loving our neighbors as ourselves, that we may truly be able to love and support one another. We thank you now for everything our eyes will see, our ears will hear, and our hearts will feel. May we use our feet and our voices to go out and do good work. We ask a blessing over the food and a blessing to those who prepared it. Again, we give thanks. It's in your name we pray. Let all those who do justice and love mercy say amen. Right, stand for the pledge, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you.
Thank you, Keandre. Next, I'd like to invite each of our goal sponsors to the podium for brief remarks. Today's speakers include Dr. Charles Creighton with Cobb and Douglas Health, Jessica Johnson with Kaiser Permanente, and Dr. Debbie Dalton with Wellstar Douglas Hospital. Please come forward for sponsor remarks.
Good afternoon, everybody. Thanks for being here. My name is Debbie Dalton. I'm the Chief Medical Officer at Wellstar Douglas Medical Center, and we are proud and happy to be sponsors of the Cobb and Douglas County, the Douglas County Chamber of Commerce lunch, and partners with, I'm just confusing a little bit with the Department of Public Health, right? And partners with the Chamber and and all its speakers. We have a very close relationship with the Cobb and Douglas County Public Health Department. We're so excited to hear Dr. Memark give her comments today and see how our community is doing. We work very closely and collaboratively all through the last few years especially, but continue to do so just to make sure that we're keeping in touch with our community and all of their health needs. Douglas Medical Center is proud to offer state-of-the-art technology, expert staff, and excellent quality and safety measures to provide care for all of those who walk through our doors. Recently, we were designated as a Level 2 Emergency Cardiac Care Center, and the cardiology team also received national recognition by receiving the Mission Lifeline NSTEMI Gold Award from the American Heart Association. This is a special recognition for that specific type of heart attack, and I know there are definitely different types of heart attacks, so yes, for the NSTEMI, it's a specific type of heart attack. It also performed its first CardioMEMS device procedure. It's an implantation device that helps keep an eye on patients who have heart failure. So once this device is implanted, it monitors your fluid intake and what your body is doing internally so that it can notify your care team whether you're fluid overloaded or something's going on with your electrolytes, and it helps them get going to notify you that there's something going on and perform an intervention as well. They also performed one of the very first few INVAR procedures. INVAR is a way of removing clots from inside of your body. So it's these clots are inside your lungs. They can go in there and manually take them out now with this new procedure. So we are performing that as well at Douglas. Recently, we have partnered with Augusta Health System, and now it is known as Wellstar MCG Health, so we're very excited about that partnership. It brings together community health and academic health. So very excited about that. We also, I think I mentioned at one of the other meetings, if you weren't here, we have a new GME program. That is a new residency program. They've been there not quite a year at Douglas Hospital. They are family medicine groups, so we're hoping that that will expand a bit of primary care services to our community as well. And October is Breast Cancer Awareness Month. I have a sister and a sister-in-law who are both survivors of breast cancer, so this month is very important for me personally, but this is also a reminder for all of you, especially the ladies, but for the gentlemen too, for the women in your life, to remind your ladies to get their mammograms, get their screening done. Anybody over age 40 can get a screening mammogram, but if there's any increased health risks that would preclude you to having breast cancer, you can qualify to get that done earlier as well. And we have 14 imaging centers within the WellStar Health System, so it's relatively easy for you to get into getting your mammogram done as soon as possible if you haven't. And we had our annual National Cancer Survivor Celebration in June. We do this every year. I think there was maybe a couple of years in there that we didn't do it because of COVID. But in June, the first one that we had after COVID started, it was a drive-through. It was kind of a unique way of doing it, but we want to celebrate cancer survivors and all the families and friends of those of cancer survivors, because it's never a journey on your own, right? You always have friends and family who are supporting you through that journey. So we have raffles and music and dancing. So next June, we'll be sure to remind everybody that you can come through and enjoy that celebration as well. So we look forward to the future. We love to collaborate with all the businesses in Douglas County and the Cobb and Douglas Department of Public Health to make sure that we keep our community healthy. Thank you so much. Enjoy your lunch.
All right. Well, I'm Dr. Chuck Creighton. I am the chairman of the Cobb Douglas Board of Health for Douglas. By state law determines who serves on the Board of Health, and one of the rules is you do have to have a practicing physician in the county serve on the board, and that's me. I've served with WellStar in Douglas as an internist for 27 years now. I also like to point out, a lot of you have heard this, but not everybody's heard this. I also happen to be a graduate of Douglas County High School from 1985. And I actually see my former principal back there. Y'all will be glad to know I never had to see him for a bad reason as principal. So it's good to see Mr. Stone back there. I'd like to thank y'all for having us. Thank you, Dr. Memark in particular, for speaking later. As a practicing primary care doctor, some of the challenges I see moving forward is, one, we say we value primary care, and on an individual level, all of y'all do. All of my patients do. On a societal level, do we really? We need more primary care doctors. Now, Dr. Dalton mentioned about the GME program. I think we have a unique opportunity in Douglas that we are training doctors, and we can let them know what a great place Douglas County is to live and work, and maybe get the inside, on some of those folks, residents out at Medical College of Georgia as well, now that we have a new relationship with them. I think some of the other challenges are more and more your health care is going to be moving to your home, okay? You're going to be seeing your doctor virtually. I was on a committee recently where we're trying to select the right solution for us to be able to remote patient monitoring. Dr. Dalton alluded to this in a very specific cardiac way, but how do we not wait till you get sick and be able to address your needs? So we're looking at that as well. So how do we leverage the technology, but in the right way? So that's just some of my brief thoughts. Thank you all for having us, and we'll go to the next.
Hello, everybody. I had to write my notes down. So I'm Jessica Johnson. I'm over our community relations for Kaiser Permanente for the Georgia region. Kaiser Permanente has and continues to be a proud partner of the Douglas County Chamber and the Douglas County community. We work to educate business leaders and the community on the importance of diversity and health equity. Two of our focus areas are maternal and mental health. The former speakers spoke on, some of the challenges we have in healthcare, and we all know too well the threat of death that plagues women before, during, and soon after childbirth. So we at Kaiser Permanente have developed a pregnancy care model called the Cocoon Pregnancy Care Model, and it puts women in the center of a protective layer with a care team and services wrapped around them to ensure that they optimize their health, enhance their care experience, and achieve the best possible outcomes. This year alone, we have provided $2 million in grant funding to Healthy Mothers, Healthy Babies Coalition of Georgia and Morehouse School of Medicine to support their work in providing equitable maternal care. To address a nationwide crisis in mental health, Kaiser Permanente believes that increasing access to mental health services is vital. Our dedicated, skilled, and compassionate mental health professionals work hard to meet the increasing demand of mental health services while reducing stigma, fostering resilience, and promoting healing. The CDC and Kaiser Permanente Adverse Childhood Experiences Study is one of the largest investigations of childhood abuse and neglect, household challenges, and later life health and well-being impact. The childhood exposure to adverse experiences increase risk for alcohol and drug abuse, depression, and suicide attempt. Although there are many factors that contribute to health disparities, socioeconomic conditions, access to care, and structural racism have a direct impact on the outcome of your health. Kaiser Permanente is committed to helping shape the future of healthcare. And to do that, we must focus on the impact we have right here in our community, where people live, work, learn, and play. So Douglas County, thank you for allowing Kaiser Permanente to partner in building sustaining, thriving communities.
Thank you again to all of our sponsors. We also want to recognize a few individuals in the room before we move on to our main program. If you're a board member, if you could please stand and introduce yourself. Heath, would you like to kick us off? Thank you. Thank you. Big round of applause to our board members. To our diplomats, the business outreach team, if you are here, please stand so that we can celebrate you and give you a round of applause. I don't believe we have any elected officials here today. Any elected officials? All right, and also I want to make sure that we recognize our Cornerstone, the 2023 Cornerstone. They are the highest level investment group. If you are a Chairman Circle Visionary Partner, if you could please stand and introduce yourself. Lisa? Awesome. Thank you so much to our Cornerstone members. Let's please give them a round of applause as well. We appreciate your commitment and your support for the Chamber. The healthcare system of Douglas is essential and a key component to helping our communities thrive. We're so grateful to have a wonderful partner in Cobb and Douglas Public Health in our community to continue to help shape the narrative and the landscape of health right here in Douglas County. Please join me in welcoming Dr. Janet Memark, District Health Director, to the stage.
right. Thank you, everybody. And everybody's got to bring their own fan club wherever you go, so you don't feel alone. All right. So thank you for coming today and listening to what I have to talk about for our state of health for Douglas County. So let's go ahead and get started. Okay. So we're going to get started with this. So for those of you who did not know, you signed up for a 1-hour education on the molecular evolution of COVID-19 virus. Just kidding. Just sit down. Everybody, don't try to escape. So this is the family tree of COVID. And so I did show it at our board meeting, and I wanted to just show you how intricate it really is, and so how far we have gone from the original strain to the hundreds of different variations that we've had. So that's all you got for COVID. For those of you that wanted more, you might have to get up and leave now. So, all right. So health starts where you live, learn, work, and play. And so that is one of the mantras that we have for the chamber and for the county. And so today I'm going to talk to you a little bit about some of the health statistics for the county. And we're going to talk about the leading causes of everything today, right? And then I'm going to end on some things that we're seeing that are coming down the line. Now, what I want you all to remember, though, is, you're not just spectators here as we have this discussion. Each of you here, whether you're a healthcare provider or whether you are an employer in this county, you have a distinct responsibility. And so when you leave here today, I really want you all to be thinking about what you can do to impact your own life, your family's life, your employees' lives, and your community's lives, okay? Because it's very important, and we can have a big impact together. All right, so let's talk a little bit about what we're looking at in Douglas County. I want you to know that most of this information I've taken is from the community health assessment that we did, and that was over the last few years, and our new one just came out. And so if you need 800 pages of statistics about everything you can imagine, please go online, because my team worked very, very hard, and it's a beautiful document, really, that shows you everything you need to know. But what we see here, when we get back to the basics, is an increase in the population of Douglas County. So from 2010 to 2020, we had an increase of almost 9% in the population. But that doesn't tell the complete story. When we look at it from 2016 to 2020, we have an increase in the minority population. And so the Black population increased by 15.6%. You have Alaskan American Indians that increased by 21%. Asians by 6%, and Latinos by 16%. Now, the white population did go down a little bit by 7% in the county. So why is that important? Well, the fabric of what we're looking at is a little bit different. And as I get into some of the health issues that we face, you're going to see that some populations are disproportionately affected. And so that should be going kind of in the back of your mind as to what you should be thinking about. And so now we have our Black population is 51%. And if you add that with your Hispanic population, you have like 60% of folks that you will see will have a lot of health issues that we're going to see later. All right, and here's that age distribution. So most of the folks are between 35 to 64%, or age 35 to 64 years old, about 40%. But you have had an increase in your people over the age of 65. So our population of people that are aging is also increasing as well, but relatively a young population. So we're going to talk about access to care, and I'm glad that our WellStar folks are here, because this is where we start seeing some issues. So I didn't go over the whole community health assessment because I want you to still be my friends when we're done. But I wanted to go over some big highlights and big points. Access to care is a considerable issue in Douglas County. When you look at Douglas County statistics compared to Georgia and the United States, so our beleaguered primary care providers, 36 per 100,000 compared to Georgia's 65. Now remember, Georgia is a Medicaid non-expansion state, right? And so compared to the country, 76 folks per 100,000. So you can see that decrease. You can see maybe in addiction, you might think, oh, well, we're doing a little bit better there, 9.7 per 100,000 compared to 5.5. But then you look at the United States, and we're really way below those numbers. And so we have an issue with access to health care. All right, and so when you look at the percentage of uninsured, so we talked about what our population is looking like. Overall, 13% are uninsured through the county. But when you start breaking it down, when you look at our Hispanic, our newly expanded by 16% Hispanic population, almost a third of them are uninsured. And so that is going to lead to a lot of health issues. All right. Douglas County has been designated as a health professional shortage area. All right, so it's official designation. When you look at how many, the percent of the people that are living that are in shortage areas, we got 34%. And then if you don't have dentists, 20%. But if you look here, you can see how in the state of Georgia, we have 201 facilities that are actually funded as facilities to take care of this. You see how many Douglas County has? None. So none out of the 200 in the entire state. And what we do have, I think it's only one, right, Lisa? One free clinic that operates here in this, and then we're also another safety net that helps, and I think Wellstar helps some too with caring for some of the uninsured and underinsured. Here's the areas that you'll look at. So when you look at the county breakdown, this is where the primary care providers are. You see a big swath of an area that has no providers at all, no primary care providers in those areas. All right. So I'm going to take a little break here. All right. So I'm going to try to break up our talk a little bit. So we're going to talk a little bit about social connectedness. So I'm going to preface this with, I'm going to give you a little lesson. Not only am I going to teach you about healthcare today, I'm going to teach you about the language of teenagers, okay? So who are the most difficult people to talk to sometimes? I have two teenagers, and it's almost impossible. So I'm going to give you a quiz. All right, here we go. This is going to help you to better communicate with your children, your grandchildren, your students, and other random moody teenagers that you may run into. Here we go. What is bussin'? Bussin'. Is it I'm busy? Is it you're loud? Is it really good? Or on the bus line? Buzzing like a bee? Bussin's really good. So my kids one day, I made something, and it was very unusual that I heard this from them. They said, Mom, this is really bussin'. And I was like, is it that bad? Like, what is, and they're like, no, bussin's good. I'm like, oh, okay, bussin's good. All right. I want you to practice these when you go home, all right? Your kids will be really impressed. And then they will ignore you again. So let's talk about death. Now that we've come off of that, we're going to talk about death. Your leading causes of death. All right, from 2016 to 2020, here are the leading causes of death that we see. We've talked about Wellstar started some new efforts in heart disease. Very, very timely, right? So this is heart attacks and blockages, cerebrovascular strokes, and then we got cancers of your lungs, trachea. We have Alzheimer's disease and COPD. So the interesting thing about these is, can anybody see something that's kind of in common with all of these? Sorry? Okay, all right, well, duh. It was leading causes of death, okay? What else? No? Smoking can be related to all of that, but smoking in a bigger category is things that are preventable, right? So you can impact some of these things, right? Not all of them, but most of them. All right, so let's take a look at the ranked causes. Now they age adjusted it, so they just kind of, leveled the playing field according to age. Now, the way you look at this is that those leading causes of death, and you see where the little arrow is pointing, and you see Georgia. If our area was below Georgia, then we're doing better than the state of Georgia. Okay, and you can see, good news is that in several categories, we are doing better, right? COPD, cancer there, and then the heart attacks, heart disease. But you can see with strokes, man, we're in the top 20% of deaths in strokes, way above Georgia. All right. So these are premature deaths, all right? So this is before the age of 75, right? I think, yeah. So these are different things. So we see from 2011 to 2015 and then 2016 to 2020, you see a change, a shift. We used to have it as motor vehicle accidents was the top. Motor vehicle accidents have dropped a little bit, but anybody surprised to see our accidental poisonings and exposure to noxious substances? Maybe you may be surprised because you may not know what that means, but 4% of those are alcohol, 94% are drugs, all right? So now we've seen this rise to the top. And then you see some of the other things. Things are concerning. Suicide has dropped a little bit, right? Probably only to make more room for opioids and drugs, but we still have it up there as a top problem. Right? And then we have the conditions in the perinatal period, and that's low birth rates and things like that. So, and we do have programs that have been working with that as well. And here you see, this is just kind of one of the breakdowns. This is when you look at opioids and drugs, you can usually, what we're seeing, unfortunately, we're going to see later some health disparities, and usually it will affect, unfortunately, blacks and Hispanics. But here you're going to see that it's white males that were most affected by opioids and drugs. And so, all right. Okay. So then we move on to hospital discharges. And so these are the causes that you'll see by age groups. Now, can you see? You can't see all of that, but can you read some of that there? What are the main things? So we're seeing from 10 years old to 44. What is one of the top reasons for hospital discharges? Mental health and behavioral health. All right? And so this was shocking when I saw this on here. And so I called up my friend Trent North, and I asked him, I said, hey, what are y'all doing for mental health stuff? Because it keeps coming up. And so he actually told me that they are actually doing a lot of really good things. And so one of the things he told me was that for ages in the 3rd grade, 5th grade, 6th grade, 8th grade, and 9th grade, they actually send out surveys. They survey these kids because those are the most critical times for having mental health issues. They survey them, and then they ask them all kinds of questions about risky behavior as well as anxiety, depression type of things. And then they don't do what other folks do, which is to aggregate them and then just take a look at them as a group. If there are some critical, concerning things that are on there, what they do is they actually contact the parents. And they get them in touch with resources, either through the company that did it or to connect them with a mental health provider. But they try to make that connection. They try to make it less threatening for the kid, because the kid may not go to the parents, and then also trying to get them help. They also have partnered with the CSB, and then they have some after hours and emergency access to mental health services for children. So if it's during the day or if it's after school, they can try to get the kids in right away. And then they also have counseling that's offered through the CSB as well in the schools, so they can try to get in and provide the access to the children while they're there. So some good work that is happening. All right, so when we look at ER visits, hospitalizations, and deaths, so I wanted to point out here, so this is Douglas County, and then in ER visits, hospitalizations, and deaths. One of the things that you're gonna see here is motor vehicle accidents. We have a lot more motor vehicle accidents as compared to the state of Georgia. I was kind of surprised. So when you're looking at 1724 compared to 1,087 per 100,000, that's a lot of folks, right? So when you're looking at age-adjusted, 1,700 per 100,000. And so you're looking at that, and so that's a much higher rate. And then we also have the poisoning, so we have the drug abuse. And then, I didn't mark it on here, but suicide in the ER visits is also higher as well. All right, let's shift a little bit to diabetes. So diabetes is an issue that unfortunately we're facing all across the country. One of the things that was surprising to me here a little bit, so we see our, compared to Georgia over there, our ER visits overall in Douglas County, 392 compared to 315. So you can see that we have higher rates overall for emergency room visits for diabetes as compared to the state. But look when you break it down. So when you take a look at folks by their race, we have people who are considered white to be 273, but then 490 for blacks, and then in our Hispanics, 548. And so you can see the differences. So when I see things like this, I don't know what you're thinking, but when I'm seeing things like this, I'm thinking that, this is an issue and that more outreach needs to be done, and we need to make sure that we can capture this population. It's probably going to be higher in them than when we look at our white population. Cardiovascular disease, very similar. So here we go. So in our white population, 292 with hypertension. And then you look in blacks, 754. And then you look in your Hispanics, 1,628. And so really it's 5 times more, right, than the white population. So you see these distinct differences. And so if I'm an employer and I employ a lot of folks that may be of different backgrounds, then you might be thinking, oh man, they probably have higher rates of these things, and so you might want to make sure that they get the care that they need. And then asthma, I think this is one of our last ones. Now this one was only in blacks. And so that's where we saw higher rates, and that is a nationwide trend that we are seeing. And so it's a question of, it's often, related to people that are in lower income, and they think maybe secondhand exposure to pollution may be at work. And then here's that age range. So I wanted to show you, so looking at all that data, so just looking at different reasons why we have ER hospitalizations, we have deaths, we have visits, and so, but we go back to the fact that a lot of that is preventable, right? But you do need some primary care doctors, but a lot of it is preventable. All right, so recommendations. So this is what the community has recommended, what the community wants. They want better access to primary care, dental, have some access in schools, insurance, cultural competency. They also want some healthy food access, diversity and transportation and affordable housing. Social support, so they want support and recognition to address racism. And then education access and quality. So helping to support our teachers, to help our students for more options. All right, you ready for another quiz? All right, what is CAP? Is it what you put on your head? Is it uppercase letters? Is it to stop? Is it to lie? Is it cool? You're right, it's to lie. So if you tell your kids, I think I look good today, and they said, oh, that's cap. It's a lie. All right? Now, the opposite of cap is no cap. So they will use that as well, just so you don't get thrown off. And they say, oh, I got a good grade in Spanish. And I'm like, really? And they're like, no cap. That's the truth. Okay? All right. Let's talk about loneliness and isolation. All right. I didn't want you guys to get too far down in this. So, social connectedness, okay, is the degree to which people have and perceive a desired number, quality, and diversity of relationships that create a sense of belonging and being cared for, valued, and supported. Why this is important? So recently, the Surgeon General came out in May with a big alert talking about our loss of social connectedness. And you all know it, right? Into the pandemic, everybody kind of ran in and we had to be disconnected from each other. Well, we're trying to come back out of it, but a lot of people are resistant. How many of you, I mean, just be honest, how many of you are really socially back up to your pre-pandemic levels? Not you, Lisa Crossman. How many, how many of you are back to where you were before the pandemic? Going as many parties, seeing as many people, having as many lunches? How many? Okay, that's pretty good. That's a pretty good, a third to a half, right? I'm not gonna make the introverts not raise their hands, but you all know who you are, who are not back out there, right? These are the things that are different factors of that. So it's the structure, what kind of relationships, like the number and variety that you have, right? The function. So you all know you have the person that you call if you're feeling down, if one that you're feeling happy, or you want to go out, or what, you have different people that serve different things. The quality of them. So you can have a lot of friends, or you can have one or two, but if you got a pretty negative relationship with them, that is not helpful. So what are we looking at here? So these are the trends that they're showing nationally. So when you look at isolation in the corner, you see how much that has gone up, right? Look at below that, social engagement with friends. That's dropped off from 60 to 20, right? So that's huge, a huge drop-off. So you can see that a lot of these have gone down. We haven't gone back up. Why is this important? Why is it a big deal? So here are the risks that it's associated with: heart disease and stroke, diabetes, depression and anxiety, addiction, suicide, dementia, early death. Oops. So do you see something familiar in this, in what I've already shown you? What were your top health issues? What were the top reasons for death, hospitalization? Very, very similar, right? 1 in 3 people over the age of 45 feel lonely. 1 in 4 over the age of 65 are socially isolated. Here's some more risks. Dementia. Increasing your risk by dementia by 50%. Heart disease by 29%. Stroke by 32%. You remember Alzheimer's was on our list? You remember heart disease was on our list? And so was stroke. Here are the folks that are most impacted, right? And some of them are not surprising. One that we haven't seen is those that identify as gay, lesbian, bisexual, or transgender. Factors that may increase a person's risk, okay? And you're going to see these. You're going to see some of these within your friends, your family, your employees, students. If you're a lower income, you have a psychiatric or depressive disorder, you're marginalized or discriminated against. Okay, now this is the majority of our population right now that has had a history, or whose races have histories of this. Challenges to resources, stress, do that. Having chronic disease or condition, having a long-term disability, being unmarried or alone, being a victim of violence or abuse. So different things that just to be aware of what risk factors you can have. And then major transitions, and we have seen that before, okay? Do you all see the pattern, right? So access to care issues, depression, suicide, diabetes, loneliness, and heart disease, loneliness, and addiction. So why am I bringing you the most uplifting conversation ever? What can you do, right? So individually, things that you can do. On top of going out and catching up with your social support. And I've been trying to do this. I'm more of a natural introvert, and so I have to kind of push myself. I ran into a few people. It was like God's way of telling me. I ran into a couple people I hadn't seen in years, and they're like, "Oh yeah, we should get together sometime." I was like, "Yeah, no," but I did. I reached out to a couple people and arrange getting back together, because they were good people that actually missed, not having them in my life. So trying to catch up. Go out, not just get your vaccines, but get your prevention. Dr. Dalton talked about that. Go in and get your mammograms and your colonoscopies and your cholesterol and glucose tests, your hypertension. Get all of that checked, all right? It's been a while. Just do it. Get your Social Security report we talked about. And you all are the people here that can be the champions, right? You have employees, you have families, you have people that need to be taken care of. And so I'm asking you to do that when you leave. For your employees, you may be completely overwhelmed by the discussion that we've had today, but there are things that you can do for your employees, physical and mental health, preventative health. So I was talking about with a group that we had people that, we had like a health fair where you would do some screenings and stuff. In one of our own employees, we were able to identify that she had some life-threatening high blood pressure, and she was able to get into care. We've had our outreach team bosses here, they've gone to health screenings, and they've had to send like 11 people to the emergency room because their blood pressures or their sugars were so high. These are the folks that are out there. They're working. They're just going about life. Physical health and obesity. One of the things that we do for our agency is that we have there's a 30-minute physical activity break that is worked into the day. Not everybody takes it, right? But you cannot do it. You can't take it for anything else. You got to get up, you got to start walking, or we have workouts that you can do online, but you got to take 30 minutes to do something. Otherwise, you just keep working. Healthy food choices, you can influence that. So maybe you don't have the vending machine with all of the candies and everything in there, right? Maybe some healthier choices that are available for your folks. Social connection, helping with that in your organization, trying to have people be a little bit more connected with activities or different things. We have a stellar kickball team for our group. Okay, that's not the time to laugh. We've scored 3 points in 2 seasons, but we have a great time doing it. And then remember that your groups that might be having trouble, right? The ones that are isolated and sometimes vulnerable. All right, it's your last quiz. Are you ready? I think you're pros. What is bet? Is it to wager? Is it crazy? Is it not cool? Is it, come on, the new word, bet? Or is it agreed? You guys are really good at this. That's right. So if you ask your kid, did you do your homework? Yes, bet. Yeah. Or no, maybe that's not right. Agreed. It's like, I think that's a good show. And he says, bet. He agrees with you. It's a good thing. All right. You're all up to date with your children's vernacular. Thank you, everybody. Please take some of this home and do something that you can help out with your family, yourself, and your employees. And thank you to my lovely employees who keep everything running, and our board who is here today. I really appreciate you. And have the best day. And thank you.
One more time. A big thank you to Dr. Memark for taking the time out of her busy schedule. She's a very busy lady, but taking her time out of her busy schedule to be here with us today and to share about Cobb and Douglas Public Health. Thank you to our sponsors, Kaiser Permanente, again, Cobb and Douglas, and then Wellstar for partnering with us in our community and sharing, of course, the great things you shared earlier. Look on your tables. Each of the sponsors have certainly shared in donating gifts for us today. Who doesn't need a COVID test, right? Take one. Take one with you. Definitely thank you again to our sponsors. So before we wrap up, I want to give a few announcements, and then just while I'm giving announcements, go ahead and pull out your tickets because we have some really great door prizes and more than we typically have today thanks to our sponsors. Please join us for our big thank you bash at the Douglas County Chamber on October the 31st. Yes, that's Halloween. We'll celebrate our chamber investors and our members. That's Halloween. Feel free to dress up. We'll have a great time there. Lastly, thanks to Greystone Power, our friends at Greystone. Yes, yes. Woo. For being our presenting sponsor today. We want to thank you for that. Do you have your tickets out? Not yet? Okay, well, gather them up. Lisa Crossman, if you could, I'd like you to come back to the stage and help us draw for these prizes. We're going to be giving away some really cool coolers, thanks to Kaiser, and then 3 blankets and other goodies from Cobb and Douglas, for Cobb and Wellstar, excuse me.
Last 4 digits, 3896.
Oh, it's me.
Ah,
All right.
last 4 digits, 4062. Wow, this is a winning table.
Yes.
They bribed me. Last 4 digits, 4052. Is it this table again? 4052.
Yay. Awesome.
How many more? Last 4 digits, 3901. 3901. All right.
Awesome.
People should have set up at the front tables. 3886. 3886. Yay. How many more? Looks like 4 more. 4 more chances to win. 4060. 40. Ah! 4053. 4053. Wow.
Awesome.
Second to last prize, 3892. 3892. All right. All right. And last but not least, 3891. 3891. Oh. All right. One more. You have to be present to win, evidently. Right? They must have had to leave. 3855. 3855. Yay.
Lucky table, huh? Thank you again to our sponsors. We couldn't have done this without you. Thank you so much. Y'all have a wonderful, wonderful day. Take care.